Hey, it's Lee Schmitt at Alabama Weight Loss Surgery. Wanted to speak about revisions, specifically revisions for weight regain. If you're having some issue with your surgery that it needs to be revised, you're probably not watching these videos. You've probably already had your surgery revised. If there's a structural problem with your surgery, but what I'm talking about is people who had weight loss surgery, whether it's bands, bypasses, sleeves, and they have initially lost a bunch of weight, and now they've gained a bunch of weight back, and they want something done about that surgically because they've tried to lose it every way as they had tried to lose weight prior to surgery, and nothing works. So yes, you can have revisions for weight loss surgery. I was very distressed to see a post on the Saints for Wellness Facebook page, which was a Facebook page that was started for our patients, and now it's open to, it's a public page. Anybody can join it. And we did not do this patient's surgery, but she said she had had revision surgery and had lost by a local surgeon and had not lost any weight. And that's very distressing. So you want to choose somebody who has experience with revisions. We certainly have a lot of experience with revisions. Some of our patients, a lot of patients who come from other places. And you as a surgeon, you have to counsel the patient and help them or steer them, guide them to the best surgical solution that's going to help them get the result they want to get. You need to know why they regain the weight. You need to address that problem, and is there something that surgery can do to address that problem? I'm very excited that there's a new procedure that I'm doing called SADI, in addition to other things I do for revisional surgery. But SADI is single anastomosis duodenal intestinal bypass, and it is a great complement for people who've had sleeve and had weight regain. So in the past, I've done bypass, and I was always disturbed that here you had a patient with a great sleeve. They were able to only eat reasonable amounts, and yet we were destroying their sleeve to give them a bypass. A gastric bypass, and now with SADI there's a better way to do it. And if you're interested in revision for weight regain, it's an individual conversation. Please call the office 205-838-3047 and make an appointment with me, and I would love to discuss the options with you. Most people will not have insurance that will pay for revisions. Very, very few people have insurance that will pay for revision. If you want a revision and your insurance does pay for it, you have to meet all the requirements that you had met before for weight loss surgery. You have to be morbidly obese, BMI over 40 or over 35 with health problems that you've had for the past 3 years. So very few people ever qualify for insurance to pay for their revision surgery for weight regain. I would love to talk to you about it. It's the new procedure I think is very exciting and is great for people who've had sleeve in the past who've experienced weight regain.